depending on the body size of that baby. Some babies are too big, others are too small, so it can as well mislead you. But at early stages, it is the most accurate. Second trimester is done between the 14th week and 26th. Within that period, most of the body parts are forming, and at 26, they are all formed. So, if there is any deformity, it can be detected. We can detect it as that at that early age. And if we detect some deformities are beyond repair, so instead of waiting for the mother to go full term, only to give birth to something which will not survive, we identify as well as that. Okay, there are other deformities which can be corrected. There are other issues like if there is reduced amniotic fluid, and we know the possible cause, maybe the baby has some renal problems, kidney problems, we can as well identify. And when we identify, the patient is put on proper medication and the correction is done before it's too late. So that one purely is to look for the development pattern, if there is any deformities, if there are any discrepancies in age, and that way we monitor the growth of the fetus. That is the purpose of the second. It is a bit tricky, and it is very necessary. One, we shall look at the presentation. Why? Presentation will determine mode of delivery. If the baby is in a sitting position, we call it bridge, at 39, chances of him turning are minimal because there is no space. There is reduced space in the uterus. So because of that limitation of that space, turning becomes a challenge. So with that, we identify a possible CISA. That is one. Number two, we also look at the development, fetal development. There could be some discrepancy, there could be some retardation in growth. You find, according to the mother, she's at 40, but if you take the measurements of the fetus, it is at 36. It's a very big discrepancy. So, if there is any growth retardation, we can as well tell. And we also look at the texture of the placenta. Placenta actually is the real source of nutrients to the fetus. So, if you look at the texture of the placenta and you find it has been, we call it calcification, it has calcified. That is to say, it has fully matured, so it has exhausted the nutrients. We identify the doctor. Now, this baby is likely to starve to death because there is no more food. So that way, they will have to go ahead and induce labor or remove that baby. We also look at other fetal abnormalities. We have complicated deformities, like deformities within the fetal spine. We pick and we know, and we can now identify. So, other than the gestational age, mode of delivery, we look at so many other things. Okay, We also look at the amount of amniotic fluid, because if the patient has renal problems, automatically there will be reduced amount of the amniotic fluid. So when we see and measure the amount of fluid and we find it is below, we also recommend removal of that baby. So those are basically the reasons why we do the scans, and that is for the first, second, and the third trimester. Purely, if you listen and you have got it, it is for the safety of the fetus and the safety of the mother. It's not a privilege. Any trained sonographer will not be very fast to say why it can compromise the safety. For example, I'll give you a very good example whereby a mother has 4 girls or 4 boys, and maybe she expected now to have a different gender. And when you scan, you go ahead and tell him you tell her that you are carrying the same gender. Can you imagine the kind of stress? The patient will come from there, will come from that room stressed. Also, look at it also from this other perspective. The patient comes with a spouse. The husband is there. Maybe the husband expected a boy, and now as you scan, you tell him this is a girl. Some will react differently. Some will be stressed, some will be depressed, and to remove those depressions, they can even resort into maybe drinking, and that way you abandon your spouse, you abandon your wife. Naye pia, she is also stressed. So, those are the kind of, okay, number 3. There are communities. When we do scans, we don't do for Africans, Kambas or Kikuyus, or we also do for Asians. For an Asian, a baby girl to them is a minus to their wealth. Why? You give dowry to your son-in-law, not the son-in-law giving you dowry now. So, when you tell an Asian that you are carrying or you are expecting a daughter, you know what they think? It is now minus their property. So that way they can as well terminate that pregnancy. And it has happened.
Okay.
Yeah. So that way you have to do a lot of counseling before you say gender. But anyway, the question you should always ask yourself, is it of any medical value? That counseling you are doing, is it of any medical value to that patient? Actually, it's more social and medical. So if you find you are comfortable with the disclosure that it will not affect the mother, then you go ahead and do it. But in the normal practice, there is nowhere in this world where you will find gender in the report. There is no report where you will find gender indicated. At 20 weeks, you'll get the gender. You'll know gender at 20 weeks, between 20 and 22 weeks. It's very possible, because what happens actually, what you're looking at and what you're looking for actually are the genitalias, the organs. Sometimes, if the baby is lying, we call it on a prone position, that is lying on the tummy, the testicles can be, you can miss them. And if you don't get them, you'll think maybe what you're seeing is a lady. So depending on the position the patient is lying, the baby is lying, you can easily miss the gender. you can give a very wrong report. If the baby is seated, that is a breech position, you can as well miss. There are babies with very small organs, so they will superimpose with the intestines, I mean with the umbilical cord, and you'll miss. If it's a boy, you'll miss. And if you miss, what will you get? So it's very tricky. But there is one position when the fetus is in, we call it cephalic, when it's coming with the head, and the spine is away, you'll get gender very nicely. It will be very clearly seen.